Back home now, and two Melbourne families are preparing to sue hospitals for allegedly failing to offer tests that could have revealed their babies had Down syndrome. The parents say they would have terminated the pregnancies if they'd known. And as Jane Cowan reports, the cases have raised questions about the screening used to detect the genetic condition.
9-year-old Sophie Dean is one of the approximately 1 in 1,100 children born in Australia with Down syndrome.
She's a great big sister. She bullies like all big sisters do. She's like all of my other children. We did go through the testing. We did find out that Sophie had Down syndrome, and we had to make that decision.
But one Melbourne couple says they were robbed of that choice. They're suing their GP and their hospital after they say they weren't told testing was available, even though the mother was in her late 30s.
In the hospital records, there is a whole page of information about tick boxes about whether tests have been discussed and offered, and none of that's filled in.
They're claiming compensation for the costs of raising their Down syndrome child.
We're not saying that they don't love their child. They absolutely love the child to bits. But just if they had been given the correct information, given to them by the proper medical care, they would have made a different choice.
In a separate case, another couple is preparing to sue a different hospital for allegedly failing to offer an amniocentesis after an early ultrasound indicated potential problems.
The court would have to decide the question of whether there had been negligence on behalf of the medical practitioner in failing to advise the parents of the opportunity of having this test undertaken, say, in the first 3 months of pregnancy.
About 1,000 women a week are screened in Victoria alone, with blood tests and ultrasounds. If those tests indicate a heightened risk, more invasive procedures can give a diagnosis. But the tests aren't automatic. Doctors say not every woman needs to be screened, but they should at least be given the option.
I do think it's a time that we actually had a national policy, so there was consistency across the country.
The former president of the Royal Australian and New Zealand College of Obstetricians and Gynaecologists, Dr Christine Tippett, says all patients aren't equal when it comes to testing for Down syndrome.
In the public system, the second trimester blood test is available and is funded by the DHS, but that testing actually only identifies 7 out of 10 babies with Down syndrome. Women in the private sector who see their GP often have first trimester screening tests, which in fact are more accurate tests. So we we identify 9 out of 10 babies with Down syndrome, and ideally we would like to see that first trimester screening test funded for public patients as well.
Family advocates say the legal cases reflect the increased costs of raising a child with special needs, but say fixing the support system makes more sense than individual litigation.
It means more resources in early intervention. It means more support for teachers in education.
There are extra problems or extra obstacles to overcome if you have a child with a disability, but they're not insurmountable if you have the proper support.
Both hospitals involved in the current cases declined to comment. Jane Cowan, Lakeline.